Now, to start with, bones and cartilages are a form of connective tissues, and they are actually the rigid forms of connective tissues, and there are other connective tissues that are not so rigid. So if you just take a look at the general arrangement of connective tissues before you go into cartilages and bones, when it comes to connective tissues in general, uh, this is how the connective tissues are arranged. There are two main components in connective tissues. I will draw it here. There are cells. There are cells, and there is extracellular material in between. Okay, cells and extracellular material. Then when it comes to cells, there are two types of cells. Now, one type is the cells that produce the extracellular material. Now, if this is a cell, this will secrete this extracellular material that is there, which I have shown in with dots. So then there are other cells. You can draw other cells if you want like this. There are other cells that do not secrete extracellular material, but they have got other functions. Like, you can have fat cells in this, and you can have immune cells. Now, especially when it comes to immune cells, they are transient cells. They don't stay there all the time. They visit the tissues. They come and go out. So they are the other type of cells. So you have cells that produce the extracellular matrix, and then the cells that do not produce the extracellular material. So that is about the cells. Then when it comes to extracellular material, again, there are two types in the extracellular material. I will delete some of these things. Now, in the extracellular material, again, you can divide it into two parts. There are fibers like this, inside this, giving strength to it. Then in between, you see these dots, which is called the ground substance. Okay. Now, one easy way to understand about the general arrangement of connective tissues is to recall how you make a cement mixture and use it for a concrete slab to build a concrete slab. Now, what you do is just like this, you mix say you mix cement, then sand and gravel. Okay, and then you mix it well, and you have a wire mesh like this. It's steel, made of steel rods. You put the cement mixture onto this, and then you get this concrete slab, where you exactly get something like this. You have fibers, these ones. Then you have cells, like gravel. Okay, and then you have this ground substance, which is like water, cement, and sand. Okay, so just remember it like a concrete mixture. Okay, so then this is the summary of all connective tissues. Even the bones and cartilages, however much they are rigid, they also have this common arrangement. They have cells in that, and some of these cells are cells that produce the extracellular material, and then there are other cells that do not contribute to produce the extracellular material, like immune cells and fat cells. Then the extracellular material itself can be divided into two parts: the fibers and the ground substance. Now, this is an example of a simple connective tissue, a simpler one than bone and cartilage. Now, this type of connective tissues is called a loose connective tissue, which is very commonly found in the body in different places. I'll show you some of the places that you get it. This is called loose connective tissue or areolar connective tissue. Some people use the term loose areolar connective tissue. Now, many things can be identified in this diagram. Now, this is a capillary. Okay, this is a capillary. And these are collagen fibers, fairly thick. And then these are elastic fibers. Okay, you can see that the collagen fibers are much thicker than the elastic fibers. And you can also see that the collagen fibers are not branched. They are like bundles. but the elastic fibers are branched. You can see some of these fibers are branched here. They are branched. Then you can see many cells in this picture. Now you can see some of these cells here. This one, then this one. All, many of these cells, they are actually the cells that produce this ground substance. White background is the ground substance here. Now they are the cells that produce the ground substance. In this case, they could be fibroblasts and all. Then you have these large cells. Okay, these two are plasma cells. They are mature B lymphocytes. So they actually do an immune function in this tissue. So this is a simple connective tissue that I just showed. Then if we directly go to the cartilage structure, cartilages are semi-rigid tissues. They are not as tough as bones. They can bend to some extent. They can absorb shock and all that. And both collagen and elastic fibers are there in cartilages. But depending on the proportion of collagen fibers to elastic fibers, you get different types of cartilages. Okay. Now there are three types of cartilages: hyaline cartilages, elastic cartilages, and fibrocartilages. The name itself suggests the type of fibers you get in that. Hyaline cartilage consists mainly of collagen fibers, and the elastic cartilage consists mainly of elastic fibers, okay, which you have seen in the previous slide. Then fibrocartilage, these are the two main cartilages, hyaline and elastic cartilage. Fibrocartilage is not so important. It is, even though you call it fibrocartilage, it is considered something in between fibrous tissue and cartilage. Okay, but anyway, you get certain places, you get fibrocartilage in the body. Now, this is the general arrangement of a cartilage. Now, here you can see outside, you see a covering of the cartilage, which is called the perichondrium. Okay, perichondrium. And then you get the main part of the cartilage under the perichondrium, like a plate. Then in the perichondrium, if you take a look at the perichondrium, you can see all blood vessels, arteries, there, branches, capillaries, and then you get venules and the nerves and even lymphatics, even though it's not drawn here. All these are restricted to the perichondrium. They don't go into the substance of the cartilage. Okay, so whatever that when you need nourishment to cells inside, that nourishment comes through diffusion. Okay, it's only through diffusion you give the things into the cells deep in the cartilage here. So you can understand that if it comes through diffusion, then that will limit the thickness of the cartilage, because you can't have a very thick cartilage, because the cells deep here will die off because there is no nutrients coming to it through diffusion. Okay, because gradually its concentration gets low and low when you diffuse something from one place to another place. Then the other point that you can understand here is that there are different types of cells here. Now, cells outside here are called chondroblasts. I'll show you the names later. Chondroblasts. And the chondroblasts, here also you might get chondroblasts. And the chondroblasts deposit this cartilage tissue here. Okay. Chondroblasts deposit this cartilage tissue around it. And when they become mature gradually, they divide and they form what are called chondrocytes. These are chondrocytes deep in the cartilage. Now, what happens is, now, since this ground substance, now this is also like other connective tissues, this is ground substance. You get ground substance and fibers, both here. Okay, the extracellular material. Then, because of this fairly rigid extracellular material, what happens is you get a space around these cells. Okay, so because in that space, you don't get any extracellular material, you get that free space for the cell to live in. Outside that, you get the extracellular material. So that point you have to remember, and these spaces are called lacunar spaces. I'll show you the names later. Lacunar spaces. So in other words, the cells, when they mature and when you go into the deep parts of the cartilage, they are trapped in the extracellular material, and they live inside the lacunar spaces, inside that extracellular material. So this, you can see the terms here. These are lacunar spaces, and the chondrocytes are found inside the lacunar spaces surrounded by the ground substance and the fibers. So the more immature ones are called chondroblast. They lie more towards the perichondrium outside. Then, as you can see here, there are many places where there are cartilage plates, like the nasal septum. Then, in places where you get cartilage plates, you are allowed, the cartilage is allowed to have perichondrium on both sides. When the perichondrium is there on both sides, the thickness of the cartilage can increase because you can get diffusion from both sides now. Okay. Otherwise, you will have to limit the cartilage thickness somewhere here. Okay. Here you can double the thickness since you have perichondrium on both sides carrying blood vessels with it. Then when it comes to growth of cartilages, there are two ways in which they grow. There is interstitial growth, which means growth from inside, from within. And then the other one is appositional growth, that is from the periphery. Now what happens is, when these cells that are inside the cartilage, the chondrocytes, when these cells multiply, then you grow the cartilage from the middle, which is called interstitial growth. Then when the cells in the periphery multiply and produce the ground substance and fibers, like the chondroblasts, then growth takes place from the periphery, increasing the thickness of the cartilage. So that is called appositional growth. Then the other point is, if you look at a newborn baby or even a baby in the embryonic state, you get a lot of cartilages in the body. Okay, many of the structures, the bony structures are also in the form of cartilage at that age. But later, when you become adults, these cartilage, they are called cartilage models of bones. These cartilages are replaced by bone. Okay, then if you compare a small baby and an adult, you get more cartilages in babies than in adults. Adults, you get less and less cartilages. Okay. Then this is an example. This image is an example to show you the interstitial growth. Interstitial growth. You can see many clusters of chondrocytes within lacunar spaces here, which adds to this interstitial growth. Okay. Then about different cartilages. First one, hyaline cartilage. Hyaline cartilage. Now this is the most common type of cartilage found in the body, hyaline cartilage. And it's found in the nasal septum, larynx, tracheal rings, costal cartilages, and articular surfaces of synovial joints. So these are some of the examples for the places where you get the hyaline cartilage. Now this is the first one is an example to show you the perichondrium on either side. So you have perichondrium there and you have perichondrium on that side. Okay, so you get this nice whitish structure. It is bluish white color in H&E stain. This is an H&E stain. H&E, hematoxylin and eosine stain. So you get this nice appearance there. Then you get, now this is an example of a tracheal ring in the trachea. Again, you should be able to identify the cartilage. This is the hyaline cartilage in the trachea. Okay, so this is the epithelium here, and this is the lamina propria that we discussed, loose connective tissues there. Okay, and this is nasal septum, nasal septal cartilage. Again, you know, it's a very nice hyaline cartilage with the perichondrium on either side. Okay. Then when it comes to this cartilages, hyaline cartilages found on the surface of the bones in relation to joints, Since the cartilage faces all the time faces wear and tear because of frictional forces in a joint, it cannot have the normal hyaline cartilage structure. So then this cartilage is called articular cartilage. If somebody asks what is the type of cartilage that you get in articular cartilage, it is hyaline cartilage. Okay, so you get all these joints, shoulder joint, elbow joint, hip joint, knee joint. The articular surfaces are covered with, if the two surfaces are like that, the two ends will be covered with hyaline cartilage, which is called articular cartilage. Now, the difference in this hyaline cartilage is that on one side, you can see here, on one side, it is bone here. Okay, cartilage is attached to bone, and all the nourishment, because bone is highly vascular, so all nourishment can come from the blood vessels in the bone, and from there it will diffuse into this as usual. Then on the other side, now this side of the cartilage is actually the joint side. Okay, so that is the area that faces wear and tear. So you get a you don't get a perichondrium there. You can't have a perichondrium there. That will get damaged because of this wear and tear. So this cartilage, articular cartilage, do not have a perichondrium on either side. Okay, and the blood, the fibers and the ground substance are arranged somewhat rigidly to give a lot of strength to the articular cartilage. You don't have to learn the you don't have to know any of these names. Okay, don't try to by heart the names, and you don't have to know the structure even. But just remember that the articular cartilage, even though it's hyaline cartilage, it's different from the other hyaline cartilages that you see in the nasal septum or tracheal rings or any other place like that, for the simple reason that it does not have the perichondrium on either side. Okay. Okay, so this is a slide prepared from articular cartilage. So these are the places you get articular cartilage in relation to joints. And here you can see it's bone here. Okay, it's bone. And this is the side of the joint cavity. You don't see a perichondrium. It's just cartilage surface. And again, you don't have a perichondrium there. Okay. So you get, by diffusion, you get nourishment. Here you get a fluid in the joint cavity called synovial fluid. Through that, you get nourishment diffusing into the cartilage from that side. Okay. Then elastic cartilage. Elastic cartilage is found in your external ear. This one. Okay. Even in the auditory canal inside. Okay. And your epiglottis, wall of the eustachian tube that connects the middle ear to the pharynx. Okay, eustachian tube. And the epiglottis is the one that controls the airway and the digestive tract in the pharynx. So the elastic cartilage is it differs from hyaline cartilage, having numerous elastic not cartilage bundles, elastic fiber bundles. Okay, this is fiber. Elastic fiber bundles in the matrix, not cartilage. You have to correct it in your notes. Okay. Then these are some of the examples for the elastic cartilage. Okay, this is epiglottis. Okay, so always when you swallow, it will move in that direction, and when you breathe, it will move in the other direction. Okay, so it has to be elastic cartilage to get this type of flexibility, otherwise it will crack. Now this is a H&E stain of elastic cartilage, H&E. Now here, even though it's fairly well stained, usually you get a very faint staining when you stain elastic cartilage with H&E stain. I doubt whether it's H&E actually. Okay? Usually you don't get this level of staining. But for you to see it, you can use a special stain. Now this black appearance is the elastic fibers in this staining. So these special stains are, you can have a silver, you don't have to know this. Okay, you can have a silver stain, or you can have, there's a stain called Verhoef's. Okay, Verhoef stain. Okay, so these are used to stain elastic fibers, and then you can recognize elastic cartilage rather than H&E. H&E is not a good stain to identify it, even though it's very clearly seen here. I think I got it from a different place. Might not be H&E. Then fibrocartilage. Fibrocartilage is found in places like intervertebral discs, some articular cartilages, I'll show you, and symphysis pubis. So these are some of the examples for that. Now, this symphysis pubis, this is where you get, now this is your one hip bone, this is the other hip bone, your pelvic region. We will discuss these things later. Now, here you get hyaline cartilage in the middle, forming a joint. On either side of it, you get, hyaline cartilage on either side, and in the middle, you get fibrocartilage. You can see fibrocartilage in the middle and hyaline cartilage on either side. Okay, so both cartilages are there in the symphysis pubis. Okay, this is symphysis pubis. So all midline joints, they have this arrangement, not only symphysis pubis. Then when it comes to intervertebral discs, so between vertebrae, so if your vertebral bodies are like this in the spine, you get intervertebral discs in between the vertebral bodies. Now in those intervertebral discs, you get this fibrocartilage ring, which is called annulus fibrosus. So this is a fibrocartilage ring. And in the middle, you get a very soft substance, which is called nucleus pulposus. So this is the point that I want to raise you. This is fibrocartilage surrounding the nucleus pulposus in the intervertebral discs. Then this is the example for articular disc. I said in some joints, you get fibrocartilage disc, which separates the joint cavity into two compartments. Now, one example is this is sternoclavicular joint. You get the clavicle here, you get the manubrium of the sternum there. So that is sternoclavicular joint. Then you get in the temporomandibular joint here. Okay, so the joint of your jaw with the skull base. There also you get a joint with the articular disc inside. We will discuss about the joints later, synovial joints and other types of joints. So even this joint we will discuss in another lecture. Then, as I said before, the fibrocartilage, it has features intermediate between proper cartilage and dense fibrous connective tissues. So then there are, if you look at a picture, you can see there are alternating layers of, now this is a cartilage layer and this is fibrous tissue layer. Again, you get a cartilage layer and a fibrous tissue layer like that. Okay. So here also, it's cartilage in certain places, then fibrous tissue in other places. Then we will discuss about the bones. Bones is a specialized connective tissue again, like cartilage. And they are now, unlike in cartilage, in bone, the extracellular component is mineralized. Therefore, it's very firm, not like cartilage. And it's very good for supporting and protective function, therefore. It's not only protective and supporting function, even though we don't take into consideration it much, it's a very good calcium ion store. And other point is bones, even though they are very rigid and firm, if you bury a dead body, after several months, you will only get only the bones are left in the ground. But even though however much they are strong and rigid, they are very dynamic structures. Okay, they are very dynamic structures in the sense that all the time in life they grow and at the same time they are removed. So the growth and resorption of bones is taking place all the time in the body. Now, if a bone is not used for a long time, especially the bones of the lower limb, if you are bedridden and you don't bear weight on the limbs, then they get more and more resorbed. Okay, so bone becomes thin and then the calcium is taken out from the bone. On the other hand, if you use bones, you bear weight on the bones, then it grows. Okay, and there is always balance between growth and resorption. That's why it can act as a good calcium ion store when the calcium is low in the bloodstream, the bone resorption takes place, and calcium is released into the bloodstream. And when the calcium is high in the blood, you do the other one, calcium is deposited in the growing bones. Remember that point, they are very dynamic. Okay. And again, when it comes to the general arrangement, you get, like in any other connective tissue, you get cells and extracellular matrix. So the cells in bones are of three types. Okay, you have osteoblasts, which are the main cells that lay down the extracellular matrix, which is called, in this case, you call it osteoid. Okay, so the main cells that lay down osteoid, extracellular material, is called osteoblasts. Then the main cells that remove extracellular matrix. I said bone is always formed, at the same time it's removed. Removal is done by osteoclasts. Removal is done by osteoclasts. So if you want to release more and more calcium into the bloodstream, then the osteoclastic activity has to increase. And if you want to store more calcium in bones, osteoblastic activity has to increase, something like that. Then the osteocytes are also a form of osteoblasts. They are mature form of osteoblasts. You have to understand it like chondroblasts and chondrocytes. Okay, the mature osteoblasts are called osteocytes. So they are there to maintain the bone matrix. Okay. Then the extracellular material in bone, there are a lot of substances. There are fibers in that, mainly collagen fibers to give the strength. Because bones are not like cartilage, they don't bend too much. Okay, so elastic fibers is not going to do much in bones, but it's mainly collagen fibers. Then then you have glycoprotein there. Okay, then the main thing that I wanted to highlight here is the calcium is found there as calcium phosphate or hydroxyapatite. Okay, so it's not only calcium ions, phosphate ions are also there as a result. Then this is a very beautiful picture that I got from internet. Now that shows you, now these white arrows show you osteoclasts. So these are osteoclasts. You can see that now this is an osteoclast here. So you see several nuclei in that. Okay, so you see one nucleus, 2, 3, 4, 5 like. So it's multinucleated cells, and you can see that they have eaten into the bone here. Okay, so it's resorption of bone here. Okay, that is the action of osteoclasts. Then these black arrows show you osteoblasts. Osteoblast is different. It has only one nucleus, and it actually lays down bone. So this bone that you see here, it's laid down by many of these osteoblasts that are there. You can see an osteoclast is several times larger than an osteoblast. Okay. So there are different hormones operating in the bloodstream. Some hormones like parathyroid hormone, they actually go and increase the osteoclastic activity. Okay, and there are other hormones like calcitonin. They reduce the osteoclastic activity and increase the osteoblastic activity. Okay, you will learn these things later. Okay. Then the general structure of a long bone. General structure of a long bone. There are several important parts in a long bone. The two ends of a long bone are called epiphyses. Singular is epiphysis and plural is epiphyses, SCS. Okay, so you have two epiphyses on either side, and in the middle you have a diaphysis. Okay, diaphysis in the middle, epiphyses on either side, and the connection, the narrow area connecting the epiphysis to the diaphysis is called metaphysis. So you get metaphysis on either side where the epiphyses are connected to the diaphysis. Okay, so that's clear. So that's the general arrangement of a long bone. Now, examples for long bones are your humerus, femur, radius, ulna, tibia, fibula. So anything can be a long bone. There are large long bones. Then you can have small long bones, like if you take your phalanges of fingers, even though they are small, they are also long bones. Okay, so they have a length more compared to their width. Okay, they are also long bones. Then in a long bone, the black line outside is called periosteum. Black line outside is called periosteum. Then the red line, there's a cavity in the middle of the diaphysis. And the lining of that cavity is called endosteum, periosteum and endosteum. And in adults, this cavity is filled with yellow marrow in adults. And even in adults, okay. And then on either side, between the epiphysis and diaphysis, you get what is called epiphyseal plate. It is also called growth plate because that is the place where you get the growth of the long bone in length. When you want to increase the length of the bone, especially when your height increases, when a child grows up, the height goes up. So the height goes up due to growth at the growth plate level. That's why you call it growth plate. It's a hyaline cartilage. It's an example for another hyaline cartilage. So what happens is the cartilage grows in that direction. New cartilage is deposited by chondroblasts from that side. And from this side, the cartilage is replaced by bone tissue. Okay, there's calcification, depth of cartilage, and replacement with bone. So what happens is the growth of the bone in that direction, it can grow in both directions. With age, what happens is this cartilage plate gets used up, and at a point when it is no more there, okay, you call it closure of the epiphyseal plate. Closure in the sense means that the epiphyseal plate has disappeared. Okay. Close means it's no longer there. So that stops the growth of that end. Okay. If both ends, if there's closure of epiphyseal plate, then the growth will stop. After that, you will not increase your height. So that's what happens to many of us around 80s and 20s. We stop growing in height. Okay. Because all these growth plates have been used up. Okay, so they are no longer there. Okay. Then in the epiphysis, inside the epiphysis, that is, away from the epiphyseal plate, you get a different type of bone, which is called, the bone is different. I'll come back to it. So in that area, you get red marrow. Now here in the cavity, you got yellow marrow. So that is basically fat inside that. Then at the epiphysis, you get red marrow. Red marrow is actually an area where red blood cells are formed. So there can be formation of blood in these areas. In a very small baby, even the middle part, this cavity is filled with red marrow. Okay, so that is also can be an area of production of blood. But later when you become adults, the middle part, diaphysis, no longer produce blood cells, but it can continue in the epiphysis, red marrow formation, the blood formation in the red bone marrow. Okay. Then covering usually these long bones, they have joints on either side, usually. So the area of the joint, the area involved with the joint is covered with hyaline cartilage, as we discussed before. So that hyaline cartilage is called the articular cartilage. Okay. Okay, so this diagram shows you an example of a long bone with different structure that I wanted to highlight here. Now, if you look at the diaphysis, now this is an enlarged picture of the diaphysis. You can see very tough bone here, which is called compact bone. Very tough bone, which is called compact bone. And inside the cavity, as we said before, you get the yellow marrow. And this is the periosteum covering the bone. So you get very hard bone here, which is called compact bone. When you go to the sides where you get red marrow, you can see a very loosely arranged bone there. Okay, it's like a sponge. You call it actually spongy bone. Okay, so this is an enlarged view of that area. Okay, so that is called spongy bone, or you call it cancellous bone. Okay, cancellous or spongy bone. So within these holes, cavities, you get the formation of red blood cells. Okay, even in this diagram, you can see you have cancellous bone here, then covering that you get some compact bone before the periosteum, this area. So it's an area like here. Here you get both cancellous bone and compact bone. Even here, the example is taken from this area. So you get both. Here you get compact bone. Here you get cancellous bone. Right? But you might not get any compact bone in that area sometimes. Okay. Then a few points about the periosteum. That is this one, periosteum, covering of the bone, this one. periosteum has two layers, outer fibrous layer and an inner cellular layer. Now, all the blood vessels that are necessary for the bone, they enter the bone through the periosteum. Okay, so then they actually pass through the outer layer of the outer fibrous layer of the periosteum, and all ligaments and tendons attached to the bone, they fuse with the fibrous layer of the periosteum. Then the inner layer of the periosteum is called cellular layer because that has got osteoprogenitor cells. So these are stem cells for bone cells, and these will give rise to osteoblasts, and that will produce the bone tissue osteoid. Okay, when osteoblasts produce osteoid from that end, the thickness of the bone can increase. Okay, the thickness of the bone can increase. From the inside, actually, osteoclasts can eat the bone. Okay, and from outside there is growth of bone, so it grows in thickness and the cavity size also increases. So that's another way of growth of the bone. It can grow in that direction, or with its the thickness can increase. Okay, now then you can actually classify bones based on their shape. Okay, now this is how you classify bones based on their shape. Now there are long bones. Now we have taken examples of long bones already. Now the long bones, as I said before, femur, humerus, or phalanges of fingers. Those are long bones. Then there are what are called short bones. Examples are the bones in the wrist and the ankle. I'll show you a different slide. Now in this diagram, you can see, now these are carpal bones. These are carpal bones, which are considered as short bones. These are tarsal bones. Again, they are considered as short bones. There are 8 carpal bones and there are 7 tarsal bones. Then you have flat bones. Flat bones are found in relation to the skull. Okay, in the vault of the skull, you get many flat bones. Then you get in the sternum, ribs, scapula, all these areas you get flat bones. Now here, so this is a parietal bone from the skull. It's a good example for a flat bone. Then you get ribs. Okay, they are also flat bones. Then you get scapula. Okay, scapula is also a flat bone. And one other point here. Now, if you take a flat bone like the skull bone, not all these bones, okay, especially the skull bones, the parietal bone of the skull, if you take, you see an arrangement like this. If you look at the diagram over here, you have compact bone here and compact bone there, inside and outside, which are called outer table and inner table. Okay, you call it outer plate and inner plate also. Then in between the two, in that area, you can see you get cancellous bone or spongy bone. Okay, so in long bones, we had cancellous bone on either side in the epiphysis and compact bone mainly in the diaphysis area on either side, covering the diaphysis area. Here in flat bones, you get compact bone on either side and the spongy bone in the middle like a sandwich. Okay, so this middle part is called diplo, and outer one is outer table and inner one is inner table. Now, why this is important is that sometimes when bones fracture, okay, when bones fracture, you can say whether it's throughout fracture, okay, from end to end throughout fracture, or it's a fracture in one table. So you can say it's inner table fracture, only fracture here, or outer table fracture, or throughout fracture. Okay, so both inner and outer tables with the middle part, diplo, can get fractured. Okay, so remember this point, it can be a clinically important point. Then irregular bones. Now examples for irregular bones are vertebrae, because they have different projections here and there. Then you have the ethmoid bone in relation to the skull and the sphenoid bone in the skull. Then even the hip bone in the pelvis is an irregular bone. Now these bones, ethmoid, sphenoid, even maxilla, they are called pneumatic bones. So the pneumatic bones are well known to be irregular. Pneumatic bones means bones with air cells inside. Now you can see a lot of cavities here. Okay, so these are called sinuses, air sinuses, okay, sphenoid. So these bones are irregular for that purpose because they get a lot of air cavities inside that for phonation. And here the increase in the temperature of air breathed in, all that, okay. Then sesamoid bones. Sesamoid bones. Now, sesamoid bones, by definition, are bones found within a tendon. Bones found within a tendon. So you get, now this is an example of a sesamoid bone in a tendon of the lower limb. In a tendon of the lower limb. And these are sesamoid bones found in relation to the thumb, I think. Okay. So you get thumb tendons, you get sesamoid bones. So even other places you can get sesamoid bone. There's no fixed place. Okay, by definition, they should be found within the tendon. Now, in that sense, if you go by that, even patella is a sesamoid bone because that's found within a tendon. So this is quadriceps tendon. This is patella ligament. Okay. So one can say that it is found in the quadriceps tendon. If you take the whole thing as quadriceps tendon, rather than giving two names. So it's a bone found within the quadriceps tendon. So patella is a sesamoid bone. So if you call it a sesamoid bone, that would be the largest sesamoid bone in the body. Okay. So that's all for the classification based on the shape of bones. Then about the blood supply of bones, you don't have to know great details about blood supply unless it is clinically important, which will be discussed when you do the separate bones and joints. Okay. Then there are 4 types of arteries that supply the bones usually. The most important one is the nutrient artery. That is usually the largest one also. And in long bones, actually, you can see a hole in the shaft where the nutrient artery enters the bone. Okay. Then what that does is it supplies the diaphysis and the metaphysis. So metaphysis is here, metaphysis is here, and this is the diaphysis. So it supplies metaphysis and diaphysis. And then you have metaphyseal vessels, separate vessels entering at the metaphysis here. They supply the metaphysis and they actually combine, you call the anastomosis. They anastomose with the branches of the nutrient artery and contribute to supply even that area. Then you get periosteal vessels, which are very important. Periosteal vessels. These are the periosteal vessels. You get several vessels entering the periosteum. You get all these long bones. They are surrounded by muscles. So you can easily get blood vessels from muscles entering the periosteum and supplying the bone. So even if you damage or obstruct the nutrient artery here, you can actually, the periosteal vessels can actually maintain the diaphysis of the bone through their blood supply if this obstruction is gradual, not very sudden. Okay. Then the epiphyseal vessels. In this diagram also you can see some epiphyseal vessels entering beyond the epiphyseal plate. Okay. So in children, we know that the epiphyseal plate is still there because they are growing. So then, these blood vessels coming through the metaphyseal arteries and nutrient arteries and even periosteal arteries cannot enter the epiphysis. So you really need to have these epiphyseal arteries to supply the two ends of the bones. But later, when the growth of the bone stops, that means the articular cartilage, the growth plate is no longer there. So then these epiphyseal vessels can freely anastomose with the branches of these vessels. Okay, anastomose means you get branches coming out from two vessels and they combine so that blood can go from one vessels to the other one. That is the meaning of anastomosis. Okay, so this is basically about the blood supply of the long bones. In the microscopic structure of the bones, we will quickly go through the microscopic structure of the long bones. Now, I will not read this slide for you since you get the PDF lecture. You can read it. I'll just show it in a picture and explain it. Now, this is a section of a long bone, like femur or humerus. You can see an arrangement here. You see blood vessels. You see blood vessels here arranged along the long axis of the bone. Okay. And you can also see periosteal vessels. blood vessels, in this case arteries in the periosteum, and these arteries arranged in this longitudinal axis are connected up with the periosteal vessels through horizontal vessels. You can see that these are horizontal vessels. The vessels transversely running and connecting with the blood vessels here also. Okay, and these blood vessels, all these blood vessels going in the bone, they lie in spaces. Otherwise, they can't stay there because of the tough arrangement of the bone. So these longitudinal blood vessels, they are found inside what are called Havassian canals. Okay, so these are therefore Havassian canals, inside which you get these long blood vessels. Okay, and the blood vessels that are there now, these canals through which the horizontal vessels pass, they are called Walkman's canals. Walkman's canals. So in other words, there are Havassian canals along the long axis of the bone. Then there are Walkman canals arranged horizontally, and the blood vessels of the periosteum are connected with the blood vessels inside the Havassian canals through the vessels passing by the vessels passing through the Walkman's canals. I think you can understand that fairly well by looking at this diagram. Then what happens is these osteoblasts that lay down bone enter the bone through these blood vessels, and they are deposited around the blood vessels in concentric layers. Okay, in concentric layers like that. Okay, so they are arranged like this around the blood vessel in the Havassian canal. So they are arranged like that, and they deposit bone on either side of them. So ultimately what you get is concentrically arranged cells around the Havassian blood vessel and concentrically laid down bone. Okay, and these bone tissue laid down concentrically around the Havassian canal are called lamellae. One is lamella, plural is lamellae. They are called lamellae. Okay, bone lamellae. Now here outer lamellae. Okay. So then this is the arrangement in a bone. Now the other point is, now these cells, I'll show you a different slide. Now here, this is an enlarged view of a, now other thing is, you take this Havassian canal and a blood vessel inside and the cells arranged around it. You take this one whole thing, you call it Havassian system. Havassian system. Okay. Now in the second diagram, what is shown is an enlarged view of a Havassian system. In that Havassian system, this is the Havassian canal with the blood vessel inside. Now these are the cells arranged around it. So they come as osteoblasts. Later they mature and become osteocytes. Osteoblasts become osteocytes. Now just like in the cartilage, these cells are also trapped inside a lacunae here, because this is a tough osteoid dugate. So they are found inside the lacunar spaces. Okay, and you can see these black lines here. You can see some black lines there. So they are these, because there are connections between these cells through their protoplasmic extensions. They are cellular processes. Okay, their plasma extends through these osteoid, and this, then you have to have very minute canaliculi connecting up these lacunar spaces. So the cells inside can send cellular processes to connect up with the other cells. Okay, then their nourishment is through these cellular processes. Okay, so from the blood vessels there is nourishment passing from one cell layer to another cell layer in that direction. Okay, so that is also a form of diffusion. Therefore, that will limit the size of a Havassian system. It cannot go indefinitely to the other direction. Okay, it gets limited. Therefore, so rather than having one Havassian system for the whole bone, therefore you get these several Havassian systems like that arranged. Okay, I think it's clear to you. So this is a very nice slide of a bone with Havassian systems. So you get one Havassian system there and another Havassian system there. Actually, what is in between here are old Havassian systems. You can see parts of Havassian systems. These are new ones. Okay, so in between you get old Havassian systems, because as I said at the beginning, bones are very dynamic structures. Always new bone is formed and old bone is removed. Okay, by bone lay down and resorption. Okay.